Hello and good day. My name is Christie Thomas. I'm a professor of medicine at the University of Iowa. And with me today is Maggie Fries, a licensed genetic counselor who works with me in our kidney genetics clinic. And it's my pleasure to bring to you today our new clinical service, the Renal Genetics Clinic at the University of Iowa, which is a specialized clinic for people with inherited kidney diseases. To get you started, let me give you some introductory facts about genetic kidney diseases. Some of this is not new to you. There are over 300 different genetic kidney diseases, from the common autosomal dominant polycystic kidney disease to the less common causes such as Bartter syndrome. As you know, genetic disease affects adults. In fact, the commonest genetic kidney disease, autosomal dominant polycystic kidney disease, is a disease of adults. Some genetic diseases may not be recognized as they may resemble diseases that are non-genetic, such as FSGS. Many other genetic diseases are very rare and may require specialized diagnostic tools. Advanced genetic testing methods that are now available improve the diagnosis of genetic kidney diseases. And I've shown you here some examples of genetic kidney diseases, many of which may be familiar to you. And our clinic is now equipped to be able to provide consultative and management services for each of these diseases. So why have a kidney genetics clinic? Well, recognizing and managing a genetic kidney disease sometimes requires a nephrologist with special expertise in kidney genetics, in high blood pressure, in kidney stone disease, and in polycystic disease. Our clinic has a dedicated genetic counselor as well, who's available to provide counseling before and after genetic testing. We have the resources to identify and deploy advanced diagnostic tools, including appropriate genetic testing methods. And as I don't need to tell you, making the right diagnosis early is cost-effective, offers prognostic information, provides guidance on management, and helps plan for anticipated complications, and can predict recurrence of disease. So what is the scope of our kidney genetics clinic? Well, we have genetic counseling services for patients and for family members, some of whom may not yet be affected with their kidney disease. We facilitate genetic testing for suspected genetic kidney disease. We provide consultative and ongoing management advice for any provider who's caring for patients with genetic kidney diseases. We help oversee the management of multisystem diseases that might have a kidney component, such as Fabry disease, cystinosis, and tuberous sclerosis. And we coordinate specialist consultative services for these patients. We assist with the transition to an adult nephrology practice for children who have outgrown their pediatric nephrologist and who now need an adult home. We also evaluate kidney transplant candidates and their related living donors who are pre-symptomatic for inherited kidney disease so that we can increase the safety of living donation. And our kidney genetics clinic service is fully integrated into the kidney transplant clinic.
So as Dr. Thomas mentioned, we do have genetic counseling available within our renal genetics clinic. And the role of this counseling as a pre-test visit would be to first and foremost promote informed choices by the patient. So we provide education about various genetic kidney diseases to the patient. We assess their family and personal history of kidney disease. And this family history is a great tool to assess recurrence risk and other familial implications. So evaluating at-risk relatives as well as those that could be potential living kidney donors. We address all the patient's questions, and we discuss the benefits, risks, and limitations of genetic testing. And some risks and limitations aren't well described or well known across the medical field. Some of them can involve insurance discrimination. So having a genetic diagnosis in the patient's chart and what that means for them.
So how have we done so far? Well, the clinic has now been in existence for a little over 3 years. And after the first 2 years, we actually reviewed our experience. And what I can tell you is that of all the patients that we saw, almost 40% of them had a genetic diagnosis made in our clinic with the help of genetic testing tools. This particular paper was published recently in Genetics in Medicine. So hopefully you've now got an introduction to our renal genetics service. My name again is Christie Thomas. My office number is shown, as is my email address. And Maggie Fries is a licensed genetic counselor. Her office number and email address is shown. Please feel free to contact one of us by telephone or by email. We also have a website, and for those who may want to refer a patient, we run the kidney genetics clinic in the medicine specialty clinic at the main campus of the University of Iowa Hospitals and Clinics. Thank you very much.
Thank you.